Core stabilization is important. It's important to do it in the standing positions. It's important to do it in the inverted position. But I think you'd be surprised if you took some of your athletes and you put them in what's called a plank position in yoga and see how long they can hold it. I've had some incredible athletes that couldn't make 30 seconds. So there are a lot of things that you can do, and the key here is just the concept, and vary it and see how it applies to your divers so they don't get bored. We talked a little bit about postural dysfunction, but it's not uncommon. This happens to be a swimmer, but she was a nationally ranked 14-year-old. I mean, there's that posture, that head and neck forward, the rounded shoulders, and her problems were all related to that. Thoracic hypomobility we talked about, the thoracic spine. The foam rolls are really common in the gyms now. You can use them. It's called self-myofascial release and mobilization, and you can restore hypomobility. This happens to be my yoga teacher, so she's got ridiculous motion. But in this position, if the arms go out to the side, you can stretch out your pecs really well also. And you can use the foam roll as again, it's self-myofascial release to get pec major, the lats, the teres major, all the muscles that pull you forward. Pec minor being a really critical one, and a nice way to stretch pec minor, which is a little muscle in the front that tilts your shoulder blade forward and causes a lot of postural problems, is to put your arms behind your back, lift your chest, because if you don't lift your chest, you're still in a slump and it puts more stress on the joint. But just bring your chest up and then start to pull back, and you'll feel it right where you should. Wall angels are important. Doing it against the wall makes you feel where your shoulder blade is going. These are just some examples of things that you can do to keep your shoulder blades in position. This is a sternal lift. This is easy. I mean, just all I asked him to do was raise his chest, and as a result, your thoracic spine goes into extension. This is an open chain exercise that some people refer to. This is either referred to as an iron cross exercise or robbery. People in Lexington would call it that. But basically, you're just positioning the shoulder. This is external rotation. Look how limited his motion is in rotating his arms out until he lifts his chest, and all of a sudden he's got more range of motion. There's a big change as you do that. So some of our therapists are using this for a neck exercise, getting the neck in position. Look, as soon as he elevates his chest, his head should go into position. He can't. And he just has some restrictions in his neck that doesn't allow him to go there. I tried. Ball walkouts, as long as they're done properly, they're great for the core and the shoulders, but you've got to make sure that as the athlete comes back, they don't swing their arm around. It's got to come straight back. It's a tough exercise. We use this actually as part of our rehab after shoulder surgery. And then this is something I'm using throwers, and I didn't have a video of what we do in divers, but instead of going to the 90-90 position, the throwing position, then we would just have them come all the way up, as if they were throwing in different directions in which the diver throws for his specific dives. And you not only get sport-specific, you get athlete-specific as far as their technique. And you can even coach somebody with this. Body blade, again, this is something that it's really tough to do this. It's tough to get the rhythm. It's tough to have your shoulder blades stabilized enough. And you would go through the motions that you would go through specifically in diving. And this is something we started doing years ago in our post-ops, but using a Swiss ball for compression. So it made it a closed chain exercise. So we needed to make sure that the diver was able to do this before we would let him do a handstand. So this is having control, being able to move it, because it's great if you lined up and rip everything, you don't need a whole lot of control. It's when you're off that you need the control. So we do a lot of it's called perturbations. And so when we go into the handstand position on this, we'll have the diver do a handstand against the wall until they have enough strength to do it. And we move them against the wall, away from the wall. And then after that, you have the diver doing a handstand, and the physical therapist or trainer just starts doing little pushes on their legs. And they have to stabilize, which basically mimics you being up on the platform with wind. but that's where you need the strength to hold your shoulder where it needs to go. So we had, in fact, at one point down in Mission Viejo, we were having the divers, we had Swiss balls, and we were using them under the platform. Okay, so this we can't do with our kids. This is Chinese kids. This is their warm-up getting range of motion. This is what we're competing against. These are old videos, so I don't know what they're doing now. But this is just loosen up a little bit, and then if you need a little bit more, we'll put you on the rack and have you hang down. Make sure you get loosened up so you've got all the motion you want. And then if you're not warmed up enough, we'll have somebody crawl up your back and put your shoulders in that kind of motion. So we're not going to be able to do that. I'm not sure it's good to do that because we don't have millions of kids that we can just throw back to their parents if it doesn't work out, and I think we're a little bit too considerate of people's bodies. So here's the summary part. Thinking back on the last 31 years, DDs have changed. I mean, Ron O'Brien predicted 8 years before Beijing what dives he thought were going to be done at Beijing to win medals. It was really scary how right he was, because 8 years before he predicted that 109C would be done. With the increased DD of dives, there's decreased drop time. The diver doesn't finish the dive as high as and line as high as he would like, or she. Can't line up and lock out, and they get caught. So I think as a result, there's the potential for more problems. I'm not saying there is. There's the potential for more problems. We talked about intrinsic and extrinsic factors. So let's talk about what the coaching and training regimen did. I feel, and some of these, I wasn't sure how strongly along with my opinions, but I figured, what the heck, at my age, I can be as strongly opinionated as I want. And this doesn't apply to every program. Everybody's got a different program. Again, what works for you works for you. I can make medical observations. I've made a lot of observations. I've seen a lot, I've operated on a whole lot of divers' shoulders. And my feeling is that there is inadequate time allowed for stretching and warm-up. That was not the case when I started. I am amazed when I go to pools now. And this was 10 years ago when the Olympic team on the way to Australia was training at Mission Viejo. And I went down to the pool, and my training was Ronnie. And for those of you who know Ronnie, you know, you read the sign on the door at the hotel room, and you know where to be and when to be there. And the practice was at 11 o'clock. You were on the pool deck at 10 to stretch and warm up so that you were on the boards at 11. And going to Australia, the divers strolled into the pool with their coaches at 11 o'clock. One of them with a Big Mac and an order of fries while he did his stretching, got up on platform, threw 3 dives, and said, I don't want to dive today. It's a different mindset. And I think the mindset of divers has changed, but clearly, I think there's not enough time to spend stretching and warming up to get ready to dive. I think we need more scapulothoracic prehabilitation. I think there needs to be more work done on the shoulder blade. I think there are clearly more injuries that I see when divers are hitting the water than from dry land, and I think there's got to be more emphasis on dry land training. I think that one of the things we've gotten into our heads, and again, this may just be my bias or my judgment, and I'm not implying that I'm right, I'm just talking about my thoughts. I think that coaches have assumed that the Chinese are who we have to compete with. They're doing a ton of dives. We've got to do a ton of dives, and I think we're seeing more overuse injuries because we're not ready to do the ton of dives. And their mechanics are different than ours as well. I think that there are more divers now. There are fewer divers diving 10 meter. I think divers see that as, their parents see that as a way of them having success earlier. So there are more younger platform divers, and the injury rate on 10 meter is clearly, and the first study we did, it was 8-to-1 platform to springboard. Clearly there are more injuries in practice, as I said earlier, but that's because there are more dives in practice than leads. I think, again, the point that I made about swimming entries, if your divers are swimming their entries out here, they're putting their arms in an at-risk position, because if they hit wrong, they're out. So what we came up with was the scapular plane is 30 degrees forward from abduction, from out here. So everything should be swung from here to here. Skill progressions have to be respected. I think the sense that I have is that younger divers are doing more difficult dives because the idea is if they can be lucky enough to hit it, they don't have the mechanics, they don't have the skill to do it. But with a higher DD, they can score more points just by doing a more difficult dive. So I think we have to be respectful of the skill progressions that are being taught. Because if the dive's too hard, there's not enough time, or there's not enough height, or there's not enough strength to complete it. So what they do in the air is they revert back to their old habits. And that's where they get injured, because they just want to get in the water. They just want to survive the dive. So what do? These are things to Dave Bergering. And Dave and I have talked about this for years, but the come out is really important. So if the elbows are out in this position, I think our divers tend to look for the water too early without their elbows being in position. So if the elbows are out here, I mean, we talk about the 90 position, 90 degrees of abduction or elevation, 90 degrees of rotation as the at-risk position for shoulder instability. So here's this diver in the at-risk position, she's reaching for the water, as opposed to this diver who's got her elbows up over her head first, and then she's reaching for the water. So I think the sequence has to be get your elbows up, grab your hands, and then reach for the water. Not start looking for the water early on. Bubble machines are great. However, I think you have to be careful about how you use them. This is, I really feel like the old guy, because this is something that we discovered in 1982, that we were seeing injuries related to the bubble machine. And so the trick with the bubble machine, and I feel awkward saying this again after all these years, is when the diver leaves the platform, you just switch it off. And if you switch it off, there's still 18 inches of bubbles at the top and nothing underneath. Because if you go in the water like this, if you rip into bubbles, the torque on the shoulder is huge. So we were seeing kids that were just doing great dives and just getting whipped around, like a washing machine underwater on a great dive and injuring their shoulders. So for the coaches who have a bubble machine, if you stand there near the switch, just flip the switch off. Bubbles are on the top where you want them. You don't want them underneath. And then John Wingfield talked to me about this. The altered competition schedule has affected things. There's the new Grand Prix schedule. It's hard to periodize training. Divers can't rest and recover from minor injuries or a chronic musculoskeletal problem. I mean, for those of you who dove, you knew how much you needed the time off. So for me, I used to do so many surgeries in the fall. I was busy with football season, but the diving season was over in August, and my window to get a diver back to the collegiate level was after nationals in August, and they had to be ready for their league in January. So that was the goal. We looked at one point we did a study that looked at wondering if the shoulder injuries correlated with hand position, which was your top hand versus bottom hand, and which is the direction of twist. There's no correlation with that at all. The intrinsic factors, so these are the individual factors in divers. There's a lack of flexibility in the front of the shoulder, which is pushing the shoulder forward. So pec major, pec minor especially, that's really the culprit. And the hip flexors are too tight. And again, there are asymmetries in diving. I mean, one of the studies that we did, it scares me when I think about how long ago, 20 years ago, when we had the national team in Lexington, is we looked at the asymmetries as far as which way they twisted and which way the divers hurtled. And we saw problems with if a diver is always coming up with hurtling, so their push-off leg is the left and their hurdle leg is their right, then everything on the right side in front has to be tight, unless they're working on getting it stretched out. So the left side has better extension, the right side has limited extension, and if you don't get them stretched to compensate for that, you develop asymmetries which eventually affect the back. And the same thing with twisting with shoulders and with the spine. Thoracic spine, I think that thoracic hypomobility is something that's critical. And we see that constantly in swimmers and divers, no matter what. As we all know, we get them in diving because they've been thrown away by gymnastics because they've had injuries. And there have been so many phenomenal divers that have come to us, somebody's sitting right there, as an injured gymnast, who eventually had ongoing problems. And again, the biome, they may have had had surgery, but the biomechanical flaws weren't identified. They treated the symptom.